the topic of today is abdominal contouring, and in particular, abdominoplasty. Again, abdominoplasty is a very common procedure, and it's done very frequently. But there are some tricks that I implement when I plan to do an abdominoplasty that makes a big difference. Again, it seems an easy operation, but if you want to do it well, it takes a lot of artwork in order to do it. So I'm going to present first the case, then I'm going to talk about common mistakes that plastic surgeons do when they perform the operation, and all the tricks that I use to maximize the results. Again, there are many ways to do abdominoplasty, but there is only one way to do it well. So here is the patient, is a 29 years old female who had an early pregnancy and was left with a lot of loose skin. I'm going to show you the picture first. This is the 3/4 view. You can see there is some diastasis of the muscle, which means the muscle is relaxed. This is a very important view that pretty much show you how much relaxation is, how much muscle relaxation there is. And again, here we are, a different view again. You can appreciate it, how much loose skin there is. So it's a lot. And here's the patient making fun over loose skin and show you really how much loose skin there is. So let's start focusing on the detail of the pre-planning of the surgery so you can appreciate it, how much different it is from other technique that plastic surgeons use. One of the most important part of the entire procedure is planning for it. Now, abdominoplasty is one of those operations that seems to be easy, but then the details make really the operation a truly success. So let's start with the common mistake that plastic surgeons do, is to place the incision too high on the abdomen. So what happens is when the skin is pulled, the incision ends up in this area here, and it shows. Also, the other mistake is to take it too far up, and then you cannot wear a low-cut bikini. So the most important thing is where the incision is going to be, and that is the main concern for patient, is to be very, very inconspicuous. So different planning, the incision in my planning is done very low, just above the pubic hair, and is extended laterally, but still in a place where it can be hidden in a low-cut bikini. Even if it has to be extended up, it is still a low-cut incision. Another obvious problem that happens is patients and plastic surgeons don't address the area of the pubic area, which is usually relaxed, and sometimes not in this case, though, has some fat present in here. So it's important to defat this area here and move it up as well to give a pubic area a very youthful appearance. So that's, again, the incision placement is probably the most common mistakes that plastic surgeons do, and patients afterwards are complaining of. A well-placed incision and a well-sutured incision will leave the patients with a very nice scar, and you're able to wear a low-cut bikini with impunity. The second mistake plastic surgeons do, some of them is, you know, there is a fair laxity of the skin in this area here too. So when I do the surgery, I come up all the way to the subcostal margin here and release the entire skin all the way up to this area here. A lot of times, patients are left with relaxed skin right in this area here, and this is due to the fact that the plastic surgeon were too conservative and they release only up to this area here and left a bunched up area here. So that's a common mistake. So a wide undermining of the skin all the way laterally, all the way here. And in this area here, it's the key for successful. So it takes time and a lot of finesse, but it's the key of success. It's like when you make a bed in the morning, you want to stretch your sheets widely in order to get all the folds out. Now, the third mistake is that there is a lot of muscle that is loose in the peri-umbilical and in the central area. So the muscle is the rectus muscle. It runs laterally in this shape here. This is the muscle on one side, it's the rectus muscle, and this is the muscle on the other side, right here. Now, very often with pregnancy, the muscle relaxes, and there is an area centrally that is called diastasis of the rectus, which is loose. Now, it's very important to tie this area together. When you, before pregnancy, you had the rectus muscle was more central right here, and it was really tight together. So what we want to do is bring back the muscle centrally and tie with the 2 layers of suture right here. So that's very important. That needs to be done in this area here, so we bring back the 6 packs you had before pregnancy. The third thing is also, it's very important after we release the skin to redrape it properly. So it means that we pull the skin down this direction, okay, and we basically make a little incision around the belly button. The skin will pull back, and this little incision ends up right in the part of the skin that needs to be removed, so it's not visible. Now, after we pull the skin up and we have removed the excess of the skin, one of the most important things that I do, and is a very time consuming, but it's very important to give definition, is to place quilting suture, means some sutures underneath the skin, from the skin to the muscle. So basically we pull the skin back, and at the same time we place these sutures underneath the skin all around, moving the skin down. So the suture are placed from the skin to the muscles. So what they do, 2 things, is they minimize the dead space that there is underneath, so you have less incidence of what we call seroma or fluid collection, which is one of the complications of surgery. And 2, will give you much more definition of your abdomen, because it sort of delineates much better the muscle. Most of the doctors don't do the suturing. It does take time, it's time consuming, takes about half an hour later, but again, most of the doctors just pull the skin, tighten up here, in an hour and a half, they're done with surgery, and that's it. And I think is a big mistake. Again, abdominoplasty it's a finest operations and needs to be done properly. So once the suture are placed underneath the skin, we're dealing with suturing the incision right here. And again, this has to be done perfectly in order to maximize the healing process. Another trick that I use is I pull more in this direction on the flanks. So what is happening is, because of the tightening of the muscle underneath, you also improve much better the contour here. So basically the contour here is tighter because the skin outside is looser too. So lots of tricks that I use in the pre-op and during the operation that makes a huge difference in the success of the surgery itself. Now let's go to the before and after picture to show the result. So this is the before and this is the after picture of this 29 years old female who underwent a abdominoplasty, and with all the tricks and details that I showed you. And again, you see there is massive skin relaxation, and you can see the skin is so tight here. You can appreciate it how the internal abdominal contouring is improved with the muscle tightening and this internal suture. And also you can appreciate it how low was the incision. So when I wear a low cut jeans, you don't see the scar. Again, this is the front view of the before and after picture. You can see how much contouring improvement has been achieved with the technique that I use, which is different that other plastic surgeons use. A lot more extra tricks to deliver a fantastic result. Again, the incision is placed very low so she can wear a low cut jean, which is very important. And again, the contouring that we obtain even at the flank area, it's remarkable. So there are a lot of ways to do abdominoplasty. You can do a very, very detailed operation with a lot of tricks, or do it in the wrong way, end up with not very optimal results.